We are back on Dead Doctors Don't Lie with your host today, Dr. Peter Glidden, filling in for Dr. Wallach. Welcome back, Dr. Glidden.
Hey, Doug Winfrey, it's always a pleasure to be here. What do you think we should talk about today?
Well, I thought maybe we ought to talk a bit about a Fox News story that I found that is headlined, Antidepressant Medication Linked with Increased Risk of Superbug Infection. Yeah, they say...
I mean, come on. This is nuts, isn't it? I mean, you couldn't write this stuff. This is awesome.
Yeah, I know. And this comes out of the University of Michigan, and they say certain types of antidepressants put people at increased risk for developing a superbug, according to this new study. And they say individuals who suffer from depression are taking antidepressants such as mirtazapine and fluorotide, and they say a much higher chance of contracting Clostridium difficile infection, or CDI. A life-threatening infection could cause severe diarrhea, inflammation of the colon, and they said one of the most common infections that is acquired by patients in hospitals. See, it's showing up more and more frequently, and resulting in 14,000 deaths a year, according to the CDC. And they say the rise in CDIs is often attributed to overuse of antibiotics in healthcare facilities. Medications destroy bacteria responsible for illness, but also destroy the protective bacteria in the GI tract, leaving individuals vulnerable to C. diff that's lurking on foods, surfaces, objects contaminated by infected feces. Now, my thing is, this stuff comes from, the tailpipe, so to speak. Now, why would that stuff be on food? I mean, are the hygiene practices in hospitals so bad that, you got somebody preparing your food and they're not washing their hands before they touch your food? It's just insane, according to the lead.
It is. It's a giant Petri dish, man. It's a giant Petri dish. I mean, if you want to really scare yourself, get one of those infrared lights that they use on CSI, and the next time you visit somebody in the hospital, just shine it around the joint. You'll freak out. I mean, this is the tip of the iceberg, though, right, Doug? Because here's the deal. Number one, antidepressants don't cure depression. They don't. Antidepressants manage depression, and they manage depression poorly. Most people that are on antidepressants, they feel only a little bit better. There's a small percentage that feel remarkably better, but it always fails within a couple of years, because it's like painting over the mold that's in the basement. It doesn't get to the root cause of the problem. It doesn't fix the problem. It manages the problem, and it's an expensive way to manage the problem, number one. Number two, because the antidepressant doesn't fix the problem, you're adding to your medical bills every month, and then you get a side effect from the antidepressant, which is a life-threatening bacterial infection, and we wonder why the medical costs are such a gigantic burden to the economy. We wonder why the economies of all free countries, U.S., Canada, the U.K., France, why they're being crushed by the weight of medical care. It's not the patient's fault. It's the doctor's fault. The system doesn't need to be tweaked. The system doesn't need to be streamlined. Hospitals don't need to be managed better. Pharmaceutical companies don't need to be reined in. The reason that all of this doom and gloom is happening all of the time, and it just gets worse and worse and worse and worse, is the one single biggest overlooked fact. It is the billion-pound gorilla sitting on the middle of the planet that nobody looks at. MD-directed, pharmaceutical-centrist treatments for chronic disease don't work. They don't work. The system doesn't need to be tweaked. It needs to be abandoned. This is why, ladies and gentlemen, longevity is, in fact, your last best hope for having your friends and family members and church members and community members have a happy, healthy, and wealthy life. For goodness sake, it's not working. Conventional medicine doesn't work for chronic disease, so encourage everybody in your life to fire their MDs. Call us up on the radio program. Join Longevity. Affiliate yourself with a Longevity member. We're thousands of us, hundreds of thousands of us all around the world. Find a way to hook up with Longevity. Become a Longevity member. Become a Longevity customer. Let us teach you how to secure your health with real-time, science-based, clinically verified, new-fashioned medical nutrition, because as God is my witness, we're suffering needlessly here. My people are destroyed for lack of knowledge. Well, guess what? There's a new sheriff in town. It's time to stop the nonsense. FireYourMDNow.com. Click the Join Longevity button and let us drag you happily into the light of medical nutrition.